Hi, so I'm Emma Nicholson and I'm a postdoctoral research fellow in the Centre for Disability Studies here. So I'm going to be talking to you about some ongoing research that we're doing at the moment when we're evaluating alternative forms of respite care in the intellectual disability sector compared to traditional forms of respite care. So the project is ongoing at the moment. So I'm just going to talk about some of the assumptions underpinning the research and why we're doing the research, and then briefly go through the methodology that we're using in the data collection. So this is the research team. We have quite a broad number of perspectives. So the funder is the Atlantic Philanthropies. There's myself and Dr. Suzanne Guerin here in UCD. We have Dr. Philip Dodd, who is a consultant psychiatrist in St Michael's House, which is quite a large service provider for people with intellectual disabilities in Dublin. And we have Dr. Fiona Keogh from Genio, who are a charitable trust that fund kind of innovative services. So it's quite important, I think, to have kind of a broad number of perspectives, and that's kind of something that we try to move into the methodology as well. So obviously, the more perspectives you have, hopefully the more viewpoints, the greater process of change we can hopefully make in the respite services. So firstly, you can talk about what is respite, and I think it's important if we're going to, if we want to change respite at a fundamental level, to maybe try look at what underpins, what assumptions underpin respite care. So if you look at what the word means, technically there's no accepted definition. People will tell you many different things. People including service providers, academics, service users and their families all tend to have different ideas of what respite is. But if you look at what the word itself means, it means it's a break, it's relief, it's downtime. So the word there is an insinuation in the word that there is a burden that needs to be relieved, and generally speaking that the family is the one that needs the break. And often service users are aware that this is the case, that they are perceived maybe as a burden on the family that needs to be who need a break. And alternatively, you often get family members often feel guilt that they maybe need this break. So that's kind of generally what maybe a certain idea of what respite is. Who's the recipient is also a question that is that comes up a lot. I mean, if you look at the idea that it's a break, the best notion is that it is a break for the family and that they are the recipient of respite rather than the service user. But so the question is, with the alternative forms, is can it be a break for the service user as well, rather than just for the family? And as I said there, different parties, they do tend to define respite in different ways, and that really is based on what their needs and expectations are. And everybody has different needs and expectations in their life. One, general factor is there's not enough of it. And families will always say that they need more and they'd like more. And generally speaking, there's a bit of frustration that there's not many options available. So one thing that we want to look at is removing the burden and the guilt from respite. If the purpose of respite is to relieve stress for the families, it's maybe a bit self-defeating if you're just relieving stress and replacing it with a feeling of guilt. So generally speaking, real respite, whatever that might be, technically should occur organically, like any relationship. Every relationship between parents and children and partners, they need a break in some description, and that might come in the form of just their own activities and hobbies, work and holidays. And as it says there, it should occur organically as just a result of time spent apart, doing everyday activities. And one thing that we wanted to address in this research is that when you look at a majority of assessments of caregivers' experience of caregiving, burden is always the focus. They rarely kind of look at the positive aspects of caregiving. And families do report there are a lot of positive aspects. Yes, there are some stressful and negative aspects, but there is a positivity to it. And generally, it's been argued that measures are needed that will reflect this. So that's something that we try to address in this research. Okay, so what is traditional versus alternative respite? So generally speaking, the Department of Health have suggested that these alternative forms of respite could be more cost effective compared to traditional forms of respite. So within our research project, what we're looking at, what we define traditional respite is just when a person spends time in usually a residential care facility in an institution for a specific period of time. And it can be on a planned basis or on an emergency basis. Whereas when it comes to alternative-based based respite. The Genio who fund the research or fund the respite that we are evaluating, they define it as a move away from centre-based services to more community-orientated and individualised services. And often they're seen as a stepping stone towards independent living. Okay. So what our research is doing, our main aim is to evaluate and compare these novel versus traditional forms of respite care within the intellectual disability sector. We're kind of using a natural group design, so we're using guys who are, or working with guys who are availing of traditional services and those who are availing of alternative services. We're looking at various outcomes, things like quality of life, the perceptions of the type of care that's given in the service, and looking at a caregiver's experience of caregiving. And we also have a qualitative component where we have some interviews with the families and the service providers. So these are some of the types of services that are being funded by Genio. And that is the key part of our research, is the alternative of a respite is being funded by Genio. So one in particular is a community-based service where they have, it's in St Michael's House, so they have an apartment where the guys go and stay for a weekend or a night or two with a friend. And it is really seen as a stepping stone towards independent living, and they get to learn skills like independent living. There's another one just has like individualised activities where they just ask the service users what they want to do and who they want to do things with. So it could be funding to go to a concert or a match overnight with their friends. And similarly, they also contacted the families just to see what kind of time frame they might need. And it's often very simple things, just like maybe time to go for a meal, to get their hair done, to just get the shopping, things like that. And there's also some of them are working off a home-to-home scheme where a service user maybe go to a family for a weekend for a set period of time. And then one interesting study that we're hoping to look at, looking at home-to-home provided by deaf people in the community for service users who are deaf. So it's quite a unique one there. Okay, so the participants. So in keeping with what I was saying about how we want to try to capture a global viewpoint and not just focus on individual viewpoints, and that's something that struck me when I was researching the literature on this. Often the views of service users tend to get left at the wayside in this types of research and looking at respite care. So we tried to incorporate 4 different viewpoints. So we are going to be chatting to the service users themselves. These are all adults with a mild to moderate intellectual disability. We talk to the primary caregivers, so these guys are all living at home. So it's usually parents, but it can often be siblings as well. We're going to be speaking to the managers of the respite programs, and we're also chatting to the key workers for each service user. So, and then, as I said, we also have a smaller group using traditional respite care. So we're talking to about 60 to 80 people using the alternative respite care across the country, and then about 40 to 50 who are using a traditional respite to act as a comparison. So, the tools that we're using. So as I said, we're looking at both quantitative and qualitative research. So for the service users, we have a quality of life scale that was developed by Roy McConkie and his colleagues in Ulster. And it's a 12-point scale that just measures loads of different types of areas of your life. And it just asks them about how they find certain areas of their life. Things like people they live with, their community, their relationship with family and friends, and the respect and control they have over their life. We are also looking at the measure of process of care from the caregiver's perspective. So it just looks at their perception of whether the service provides family-centred care. We're also looking at the experience of caregiving inventory, which is a measure that we developed or we revised for use in intellectual disability. So as I was saying there before, when you talk about caregivers' experiences, they often talk about stress. And this is quite a unique measure in that it was originally designed for caregiving for people with mental health problems, but we decided to change it for intellectual disability. So it looks at positive aspects of caring, but also looks at maybe the stressful and negative sides of caregiving too. So it incorporates both perspectives. And this is the first time it's being used in research. And we also have an interview with the family just about their perceptions of the respite service and what they hope for the future, and what they feel like their family member gains from the respite service. We have another quality of life measure. It's called the INICO-FEEX. It's a Spanish abbreviation. It's another quality of life measure that comes from, it's on behalf of the service user, but filled out by their key workers. That's somebody who would work very closely with them in all areas of their life. And then we also have a semi-structured interview that we're talking that we talk to the managers about the idea for the service, the history behind it, why they felt it was necessary, and what they hope to achieve from it, and maybe what some barriers of the service continuing. So our outcomes for the research are, so hopefully, as I said, we've kind of a broad perspective of viewpoints, and we hope that it can provide, so by getting all the viewpoints of all parties available, that it can hopefully lead to more progressive and appropriate services being used in the future. And hopefully we want to look at where different viewpoints, and one thing that we're looking at is just asking the different stakeholders about what they think respite is, what their definition of respite is, and looking at where these viewpoints coincide and where they diverge. And hopefully that can help produce more appropriate, individualised types of respite in the future. And that's it. Thank you very much.